Hi guys, so today I want to talk about sudden infant death syndrome. So a few days ago, I ran into a mother who narrated how she lost her 5-month-old baby. So according to her, she said that on that very day, her baby was very healthy, that she just fed her, gave her a warm bath, and then laid her on the bed. But she laid her on her stomach because she thinks the baby is having abdominal pain. So to ease the pain, she just laid her on her tummy and then went ahead to do the house chores. But then she comes on an intervals to check on the baby. She just comes and check on the baby, and then after like 30 minutes she came to check on the baby. After an hour she came to check on the baby. The baby did not move. Then after like 1 hour 30 minutes she came back and she was like, this is very unusual. So she went ahead, carried the baby, and then as she was trying to wake up the baby, she found out that the baby was not responding. Then she rushed the baby to the nearest clinic, where the doctors on ground told her that the baby is dead. So this is the actual picture that we see in sudden infant death syndrome, and some of our activities and what we do to our baby predispose our baby to this syndrome. Like laying our baby on their stomach can cause this sudden infant death syndrome. The way it does this is when you lay your baby on the stomach. These babies are very young. They have not achieved the neck control. They can't carry their heads. Okay, so when you lay the baby keeps on taking in expired air, and this can lead to hypercapnia, which can cause death on this baby. Another thing that we do, that we mothers do, is sometimes we try to cover the baby so well, and babies, they cannot, their auto regulation mechanism have not fully developed, so they cannot regulate their temperature effectively like an adult. So and this can predispose to death. Another thing that we do that can predispose to this sudden infant death syndrome is when you sleep on same bed with your baby. Sometimes you can just throw out your hand and then you can just sleep on top of the baby. Sometimes you can use your shoulder to block the baby's nostrils, and then this baby will not be breathing well. And this, before you know it, within 5 to 10 minutes, the baby is already dead. And then you just wake up and then you find out that you're sleeping with a dead baby. Another thing that we do is laying the baby together with their toys. Sometimes they can move their hands and then take that toy and then place the toy on their nostril, making them not to breathe well. Okay, and this, from there the baby can go from there. So these are the things that can predispose to sudden infant death syndrome. There's what we call the ABCs of safe sleep. One is you let the baby sleep alone. They should sleep on their back, and they should sleep in their own separate crib. With this, I hope that you've learned something. So please like and share so that others will learn. Thank you.